I've been invited by Dr. Gallow several times to come up and visit him. He's visited me at the clinic in the Bahamas several times, both accompanying patients that we're co-managing. And that's partly the way I met him originally. I'd heard about Dr. Gallow from a fellow medical student that graduated with me in medical school in Montreal, who was working in a clinic where Dr. Gallow used to work. And eventually our paths, because this is a small world, and physicians that think in the terms of the way that Dr. Gallow thinks, in terms of integrative therapy and energy medicine. And eventually we did share patients and did cross paths thanks to the patients that we were both managing different aspects of their care. So, and you know, so he's invited me several times to come up, and I am going to be doing his mindset course to learn more about what he does. So that was my primary reason for coming up here, was to learn more about what Dr. Gallow does, because one of the things that I face in dealing with cancer patients is that I don't have the time or necessarily even the skills to deal with a lot of their energy issues and their emotional issues, and I'm always looking for new techniques to help with in that area, but even more importantly, looking for good people like Dr. Gallow to refer to. So you know, so with that introduction, I'll tell you a little bit about myself. I was originally born in Freeport in the Bahamas, and went off to school. Another thing that I share with Dr. Gallow is I also have a fine arts background, but not in music. My background is in the visual arts. So I have a fine arts degree in the visual arts, and after that I went on, did another biology degree, but then went on to medical school in Montreal at McGill University, did an internship at Hopkins, and then residency at Baylor University in Houston, Texas. And then after that, just a whole bunch of studying, which is ongoing to this day. So eventually, it was inevitable, I guess, that I would end up in working with cancer care in an official way. As a family doctor, I have more than enough patients that end up having to deal with cancer, and that's not the reason that it's inevitable. The inevitable reason is because I have a strong family history of cancer, so it becomes very personal. I have many family members who I've lost over the years with cancer, and many that are currently dealing with cancer. So when I talk about prevention of cancer, it's from a personal reason. I'm looking, you know, for myself. Any recommendation that I make would be something that I've scrutinized over, and you know, from a personal point of view, you know, this is something that I would take because I'm trying to prevent cancer, and I want you to try and prevent it too. But you know, prevention of cancer is one thing, and there are lots of studies that talk about various different nutritional, you know, supplements that help prevent cancer. But then once someone gets cancer, all of a sudden those same things are supposed to no longer be helpful or beneficial. Well, there may not be the level of you know, investigation to document that, and part of the reason is because once patient gets that diagnosis, they get put into a pipeline that totally ignores that whole aspect of their health care, and it's just it's unfortunate, you know. So that's one of the frustrating things, you know, about medicine, and that's where the Integrative Cancer Therapy Fellowship came about, because there are enough of us physicians out there that realize that, and realize that there's a whole lot of information out there about energy medicine and nutritional therapies and emotional therapies that are beneficial to patients that are dealing with something as serious as cancer, and it needs to be integrated in with all the other beneficial things about standard care. So that's where I arrived to, and once I had gotten comfortable and knowledgeable enough to deal with that, it was inevitable that I would end up at the Immune Augmentation Therapy Clinic in Freeport. So just briefly, I'll tell you a little bit about that clinic and what that clinic does and maybe why it might be special. It was founded not by myself. I've only been there two years, officially, but I've known about the clinic for many years because, like I mentioned, I've had family members with cancer, and some of them over the years had benefited from the treatments at the Immune Augmentation Therapy Clinic. So I'd known about it pretty much all my life, basically, or since I was a teenager. In 1978, Dr. Lawrence Burton moved the clinic from New York to Freeport because Freeport allowed more latitude and freedom for him to further investigate something that was new at that time, which was the role that the immune system plays in preventing and treating cancer. He had identified that there was a role for the immune system because he started off in traditional approach to looking at medicine in the 50s and 60s and early 70s, where they were looking for chemotherapeutic agents. He was looking at alkylating agents in particular and how they would kill the cancer, and testing them on mice and other animals. And what he noticed is that you give a lot of these toxic agents and it may indeed poison the cancer cells and expectedly may poison some of the living healthy cells in that animal, but it would also knock out the immune system. And he noticed that when you knock out the immune system, the mouse wouldn't live as long. So even if you're shrinking the tumor, they die of other things, infections and all kinds of other things. And then he took that a step further and said, well, what if we purposely knock out the immune system in these mice? Will they develop cancer sooner? And sure enough, he demonstrated that using some of the very same chemotherapeutic agents that were being used to treat cancer, that he could actually induce the cancer by knocking out the immune system. So he had to take a big step back and go, wait a minute now, what in the world am I doing here? Maybe the approach that I've been taught, about how to deal with cancer is not the best thing. Maybe there's a big piece of the puzzle that no one is looking at, and that's the immune system. So that's what he devoted the rest of his life's work to. And basically through a lot of trial and error, because he was on the forefront, way ahead of a lot of people in this area, he discovered things that only later were named and given names that we commonly use in medicine for, such as tumor necrosis factor and the role that the cytokines, the proteins that are produced by the immune system, have a role in coordinating the role of the immune system to coordinate not only the immune system's attack and keeping the balance and the bacteria and viruses and parasites and cancers that we may encounter throughout our lifetime. He determined that there was a balance. There was two sides to this immune system. There was a side of the immune system that was used to deal with acute infections. So acute things are like catch a cold or a bacterial infection, sore throat, and pneumonia, something. So there's a side of the immune system that signals and coordinates that, and then there's a side of the immune system that deals with in a chronic way, and that chronic side of the immune system is overactive in things that rheumatoid arthritis, where you have a chronic inflammation that's actually going on and doing damage. And cancer falls into that category too. There's the immune system of someone with cancer and the immune system of someone with rheumatoid arthritis or some other autoimmune disease. From the point of view of what Dr. Burton was looking at, this mixture of these cytokine stimulating molecules was very similar. So he grouped them into those two halves. And of course the natural instinct would be, all right, well, the cancer patients have too much of this chronic side, which in modern medicine we've given the name of T helper 2, Th2 side of the immune system. That's what any immunologist or any doctor will recognize that. And then on the acute side, the modern term for that is T helper 1 classed cytokine response. So the natural instinct would be to give a lot of the acute, because that's what we have too much of the chronic and not enough of the acute. If we can boost them up, by giving the acute, then we can, rebalance the immune system. And he tried that and he found that that didn't work. You needed to balance both systems. By definition, it's balance. I mean, it's imbalanced if you keep putting weight on one side of a scale. It may, pass through a momentary state of balance, but keep putting more and more on that one side, it's going back out of balance too much in the other way. So he quickly realized that, and this was true while I was in medical school in the early 90s. They figured out how to make some of these very same cytokines, make them commercially available. And there are things like interleukin-2 and gamma interferon and tumor necrosis factor. And they figured out how to make these. And I remember it, being announced on the news, network news, TV, that they had discovered a cure for cancer. Because they knew from Burton's work that these things have a beneficial effect. But they just figured that they could put just interleukin-2 in a vial and give that to a patient, and it would boost up their immune system to fight the cancer. And they announced it because in the laboratory, in a Petri dish, you give it to cancer cells, it may indeed do that, but in a living system that needs to be balanced, it doesn't work. And that's exactly what happened when they tried to do that. So they still use interleukin-2 to treat certain cancers like melanoma and stuff. It's a part of the standard process, protocol for treating certain cancers even to this day. But what they missed is that it's like a baseball or a football team. You can't just put the quarterback out on the field by himself and expect him to win a game. And you can't even expect you can take all the best quarterbacks in the NFL, put them together on one team and have them play the worst team in the league, and that team will still beat the team of quarterbacks because that's not a team. You've got too much of the one thing, so it's not balanced. You need a whole team to successfully get the system back in balance. And the thing is that he figured out a way to put these in balance, and the tools that he had available. This was before the days when anyone had figured out how to manufacture these individual things. What he did quite simply, and it's such a simple thing, is he'd get the blood from a young person that didn't have cancer, that was otherwise healthy, and isolate these groups of signaling molecules from the blood, that screen through the blood bank and everything else, and use those in small daily doses to rebalance the immune system on both sides. So, that concept was way ahead of its time. Like I say, now in medicine they do use these same cytokines in individual doses along with chemo in different ways to try and treat cancer, because we know that they boost the immune system, to fight against the cancer. But it's not as simple as just giving any one of them. Like I say, you can't just put the quarterback out there and expect that he's going to be able to do anything. You need to put the whole team. And where do you get the whole team? Well, you import a team from someone who's healthy, from their blood. That was the concept. That was the only thing that he had really available to do. Where else am I going to get these things from? So that's what he did, and that basic approach and other developments since that is the basic approach that we use at the IAT Clinic. We do nutrition and a whole bunch of other things, and like I said in the beginning, is that one of the biggest limitations that I found in dealing with this is, we can get the immune system balanced for the most part, but the immune system is so influenced by your emotional state and other physiological, structural, biochemical, things that are out of balance in other areas of our lives that I end up spending a lot of time, more time than I could possibly devote to a patient, trying to help them in those areas. And so the only solution is to find someone like Dr. Gallow to help manage patients like that at the clinic. So I'm up here because I want to be able to send everyone to Dr. Gallow to be able to get that aspect of their care. Because when you go to the clinic like the IAT, you get a 3-month supply of medication that you take home, and continue the treatment. But meanwhile, they need to be continuing with their I mean, if I initiate it or whoever initiates the emotional work and the other energy work that's being initiated, so really, you know, it needs to be something that the foundation is to have a good physician like Dr. Gallow back home. And that's the biggest limitation, is because patients will come and they'll go back to their family doctor, their internist, their oncologist, and those doctors, for the most part, 99% of the time, aren't even interested in what we're doing. And those that are, they're interested only from the point of view that they want to just sort of poo-poo it or something, you know. So they don't, or they're interested enough to say, well, it seems to be working and helping you. You just continue to do it, but you know, I don't really want to know about it. No, I don't need to talk to Dr. Bethel, you know. So, you know, and that's frustrating. You know, I'd love to be able to have the type of relationship where I know they're being taken care of by someone like Dr. Gallow back home, instead of going back into a system that, to a large extent, ignored the early signs, like we're talking about with the mammograms. You know, imagine if you had a 10-year lead time with a test like this that can give you a heads-up warning that you have a problem that could eventually, you know, lead to something like cancer. You know, if every physician was offering this to patients, there would almost be no need for a clinic like the IAT. We'd be making huge inroads into prevention. And then all of the nutritional and the energy work that he does, and the structural work with the adjustments, you know, layer that all on top of it, you know, you're going to, you couldn't be in better hands, you know. So God forbid that you did have cancer. All of those things that I just mentioned that are offered with Dr. Gallow are so important. You know, a treatment like the IAT, the immune therapy, is going to be one aspect of the cancer treatment that's going to be dealing with the cancer, because you got it and you got to deal with it. And it may still include radiation and other treatments, surgery, maybe even some form of chemo. You know, all of those things are individual decisions that you'll have to make with your doctors. But all of that, you know, the key that ties all that together, the true integration, is to be able to have, you know, someone like Dr. Gallow that can help keep all of those things cohesive and functioning the way they can in your body. A prime example. So Dr. Gallow has treated me since I was here for a problem that really defied explanation or anything for a few weeks now. Just this oddest pain that I had in my neck here. And I have a chiropractor. I've always had a chiropractor in my office back home in Freeport that does kinesiology in a similar way to Dr. Gallow, but not nearly as deep or to the level of knowledge that he has. And believe me, I mean, we had been trying to deal with this strange pain for a while. And yesterday I got a treatment, and Dr. Gallow figured out all the aspects of why this pain was here, including you know, emotional issues, structural issues, biochemical, nutritional issues. And some of the things, as soon as he said them, you know, tested me and figured them out, you know, I go, well, yeah, that's so obvious. You know, sometimes, and you know, in the case of like the magnesium, it was something that I used to take on a regular basis, and I don't even know why I stopped. But now I realize that that was the biggest some of my problems that I was having, as minor or significant as they were, started because I had just stopped taking magnesium. And you know, it's one of those things that is a prime example. You can't sometimes always see things, you know, yourself. You know, the shoemaker's children go without shoes and all those sort of things. You know, you need someone from the outside to make you, you know, really see things for as they are. And Dr. Gallow really has that ability to do that. And, you know, I just want to thank him so much for that. And, you know, and over again, I can give you examples of patients that we've co-managed where you know, similar things have happened, where he's been able to help the unhelpable. And those things are so important, especially, you know, with someone who's dealing with something so emotionally heavy as a cancer. You know, just the word cancer scares people. And there are many diseases that can be equally disabling or painful, but cancer scares people. The mere idea of even facing it, and just the emotion of sometimes how they were told that they had that diagnosis can sometimes trigger off in the patient a whole cascade of health problems that certainly do not even make their situation with the cancer any better. Sometimes patients can just get depressed, if they're just sort of in a nonchalant way told, come on in and, let's look at your mammogram. Yes, there's a spot on there. It looks like it's cancer. Well, I'll set you up for a biopsy next Thursday. See you later. There's your 10-minute consultation. And they're like, I didn't even get a chance to answer questions. So the next time they come in, they ask the doctor questions. Yeah, Mrs. Smith, you've got a cancer, so we'll schedule you next week for a mastectomy. Wait, I still have questions from last week. Now you're telling me I have to have this. You can quickly get pipelined in and never, and all of that energy and those subconscious thoughts get translated in your body in ways that can harm and make the situation worse and create other problems. It can actually cause that cancer, because you have to ask yourself this question, why does one person who have breast cancer, for example, it goes into their bones, and then another person doesn't go at all into their bones, it goes into their lungs. And another person doesn't go into the bones or the lungs, it goes to their brain. And another person, it goes to the liver. And when you look at them and look at what's happening in their life and the various other medical issues and structural issues and accidents that they've been in and other traumas to their life, this is the reason that the cancer is behaving that way. The cancer will go to a weak area in the body, to put it simply. Just think of it that way. It's going to go to the area that is weak, and it will go there and set up house. And then once it sets up house, it becomes an issue, a problem that yet again has to be dealt with. So the important thing that I'm realizing is that, like any medicine, if it's not able to be accepted by the body, that's a nutritional therapy, a homeopathic therapy, an immune therapy, like one of the ones that we offer at the IAT. If the patient isn't able to understand, on a subconscious and a structural level, how that therapy is supposed to benefit them and where it's supposed to benefit them, it won't be able to do its job properly. A real simple example could be as simple as a blood pressure medication, separate from cancer, just something that anyone can imagine. You get a blood pressure pill and it doesn't seem to work, so the doctor adds a second agent and then a third agent, and still your pressure's not down. Well, one of two things is happening. Either that doctor has really bad guess luck, guesstimates. He's picked 3 medicines just off the top of his head or her head that just happen to not work. Or actually those medications should be lowering, but they're not even being absorbed. So just something as simple as getting the digestive enzymes and the hydrochloric acid level, all of a sudden they may need to come off of most of those medicines, may only need 1 blood pressure pill, even if that, because that's the root of the problem. Without those digestive enzymes and stuff that Dr. Gallow can detect very easily with his exam, they're not going to absorb the medications, and if they're not absorbing the medications, well, they probably weren't absorbing a whole list of nutrients over the years, and those lack of nutrients are probably what caused the blood pressure issue and other problems that they have. And, so you have to trace it back to its root cause. And the root cause is from a medical point of view, may be something biochemical, hormonal. But at a deeper level, it's also emotional, because then you have to ask, well, how come my hormone levels dropped earlier than they should have, for my age? How come I went into menopause in my 30s, or something like that? How come that's happening to me? It doesn't happen to other people. Well, you have to look at the whole bunch of other things, You can think of that drop in hormones and give the patient hormones and they'll feel better. But there's a level deeper, how come those hormones dropped? There's always... you keep asking, how come? What caused this? What caused that? And you keep going deeper, and that's the one thing that I've noticed about Dr. Gallow, is that he will keep going. He will take the time to spend with you. Good evening. Come on in.
Hey, how you doing?
There's a seat right over here. Yeah. So that's something that's always impressed me about Dr. Gallow. And so, you know, like I said, I'm here to learn, you know, and I'm happy to talk and answer questions, you know, specifically about cancer. It's such a huge topic. Like I said, I just gave you a little historical synopsis of the IAT and where it started, and give you a little hint of where it's going. We've got new therapies, and I can talk to you about that. But all those things are sort of situational, specific, and you know, I could easily talk more about that. But I think it's just to give you you know, an introduction and to tell you that you know, even though we may not have a team that is physically here all the time, you know, we can all come and visit, you know, like Nina comes in periodically to do the mammograms, you know, and also we don't have, in today's world, we could be Skyping and consultating that way. You don't have to have the physical team directly in one premises. You know, the team now can be, you know, around the world to a certain extent. And, you know, the ability to travel, like I say, you know, you have specialists that will come here, you know, maybe once or twice a month to offer certain aspects of care and investigation that make this really quite a unique center, what you're sitting in right now. So with that, I'd like to, who else is talking tonight? Is Michael going to talk?